The feds have extended grandmothered health plans once again. These plans are sometimes called transitional health plans. They were extended one more year by the federal government, and this came by way of an insurance standards bulletin that was sent to states. It said, states, you are allowed to continue to sell these non-compliant plans. And by non-compliant, we mean they do not meet the requirements of the Affordable Care Act. These are allowed if states approve them for policies that begin on or before October 1st of 2020. Now, right now, grandmothered health plans are allowed in about 36 states. But again, the feds are allowing it, but it's ultimately the states that make the decision if they're going to move forward with this renewal or extension. Now, when we say that these plans don't comply with the Affordable Care Act, we mean major provisions like community rating, guaranteed issue and renewability, coverage of essential health benefits, and the ban on pre-existing condition exclusion. Now, it's hard to believe that any of these plans would still be around, but they are. So individuals need to look very closely at the plans that they have now to see if they are compliant. A lot of customers have come to assume that all plans protect pre-existing conditions, but in the instance of grandmother health plans, they don't. So why are they still around? Well, it's a way for some insurance companies to say, we're going to continue to offer a little bit cheaper coverage because it's not as comprehensive. The fact that the feds keep allowing them is questionable. They are pulling healthy and wealthy people out of the Affordable Care Act risk pool. Customers who maintain grandmothered coverage tend to be a little bit healthier and therefore a little bit cheaper. These plans are medically underwritten and provide fewer benefits and also fewer financial protections. So some customers and consumers are surprised when they do get big medical bills for some of the services that they thought were covered, but ultimately are not. So they are generally a little cheaper than some of the Affordable Care Act plans. They are more attractive to some of those healthier and younger employees. You can read that bulletin. Ultimately, it's up to your state whether they're going to adopt this extension for one more year. If you have questions on grandmothered or transitional health plans, you can send us an email, and you can find us at healthwatchwisconsin.org.